Volleyball thigh injuries.
One of the injuries is hamstring strain. So, what is hamstring strain? Hamstring is the muscles that help you bend your knee and extend your hips. These are the hamstring muscles, which are biceps femoris, semtendinosus and semimembranosus. Hamstring pull happens when one or more of these muscles get stretched too far and starts to tear.
Symptoms.
They are sudden and severe pain during exercise, along with a snapping or popping feeling, pain in the back of the thigh and lower buttock when walking, strengthening the leg or bending over. Tenderness and bruising. There are many causes of hamstring strain. They are past hamstring injuries, skip warm-up before exercising, overtraining, poor flexibility, and weak glutes. And also the muscles in the front of your thigh, the quadriceps, are tight as they pull your pelvis forward and tighten the hamstrings. There are many prevention for hamstring strain. Warm up before and stretch after physical activity. Boost the intensity of physical activity slowly. There is no more than a 10% increase a week. Stop exercising if start to feel pain in the back of thigh. Stretch and strengthen hamstrings as preventive measure.
Treatment.
One of the treatment is Rice method, which are rest the leg, ice the leg, compress the leg and elevate leg on the pillow. Take anti-inflammatory painkillers, practice stretching and strengthening exercises, and if the muscle is torn, you may need surgery.
Jumper's knee.
What is jumper's knee? Jumper's knee, also known as patella tendinitis. Jumper's knee is caused by overuse injury due to repeated stress on the tendon. This causes tiny tears in the tendon. These are the symptoms of jumper's knee. They are pain with jumping, running, or walking, pain and tenderness around patellar tendon, pain when bending or straightening your leg, and swelling. These are the treatment for jumper's knee. Use non-steroidal anti-inflammatory medicines like naproxen, rest and rehabilitate the knee. Start working out again with reduced intensity. Use ice pack to reduce swelling.
Groin strain.
Pulled groin muscle is caused by either overloading or overstretching the muscle. These are the symptoms of groin strain, which are bruising or swelling. This might not occur until a couple of days after the initial injury. A sudden sharp pain in the groin area or adductor muscles, tightening of the groin muscles that may not be present until the day after competition. These are the treatment that we can do, which are compress your thigh using an elastic bandage or tape. Ice the inside of your thigh to reduce pain and swelling, doing it for 20 to 30 minutes every 3 to 4 hours for 2 to 3 days, or until the pain is gone. And take anti-inflammatory painkillers like ibuprofen and naproxen. These painkillers will help you overcome pain and swelling. But, please refer to doctor before consuming any medicine if you are not familiar with it. Prevention that we can do for groin strain are do regular strengthening exercises for your thigh muscles, especially if you had a groin pull before. Warm up your legs and groin muscles before physical activity and wear shoes with good support that fit well. Always increase the intensity of your physical activity slowly, which is no more than a 10% increase a week. Stop exercising if you feel pain or tightness in your groin or the inside of your thigh. This is the video about how to treat groin strain using kinesiology tape by John Gibbons.
In this video, we're going to look at a taping for a strain of the adductor muscle group. When patients have pain on the medial side of the groin inner thigh area, then it's very common to be coming from the adductor muscle group. Just rule out any pathology from lumbar spine, and in particular the hip, because the hip will give you pain in this area of the adductor and the groin. So if he's been playing football, let's say, and he's felt a strain in this area, and if I just mark the area with a sticker. Let's say the pain is around the adductor longus area, or you might even have pain maybe slightly more towards the femoral triangle. Then again, it might be one of the smaller adductor muscles like the pectineus. So what I've done is prepared 2 eye strips, so we're going to just offload this area. So the first one, I'm going to peel this area back, and with the leg being in this position on stretch, this is a position I tend to use to actually encourage a lengthening of the adductors. So if we look at the measurement here, so I want to roughly cross that. So I'm going to go down towards where the adductor magnus will insert of the adductor tubercle here, and the gracilis will pass to the pes anserine. So one of them is going to go to that inferior part of the patella, like so. And then this tape, little to no stretch, lay that down, so that's going to come down. If I've timed it right, that's just going to come right under, excuse me doing this, just there. So that's the first part. And the second one, if I peel back the first square and apply that tape, they're almost next to that part of the first tape. Because the adductor muscle groups, there's 5 major adductors, so we're going to try to offload the adductor group. So from there, little to no stretch, I tend to leave a slight gap, and that's just going to cross under, like so. And using the back of the tape, warm up the glue, and so it becomes a bit more adhesive. There we have, can you hold your tape in for the adductor muscle group.